You open your eyes every morning, and the first thing you reach for is water. Not because you're thirsty in a pleasant, refreshed sort of way, because your mouth feels like sandpaper, like something dry and thick is coating your tongue. Your lips stick together slightly, your throat feels tight, and until you drink something, 2, 3 glasses sometimes, you cannot quite get comfortable. You have mentioned it to your dentist, who said drink more water, to your doctor, who checked your medication list and shrugged. Maybe you got some dry mouth rinse at Walmart, the Biotene kind in the green bottle, and it helped for an hour. But every single morning, same thing. You wake up, dry mouth, reach for the glass, and somewhere in the back of your mind, you have told yourself, this is just aging, just the way things are now. Here's what I need you to hear. Waking up with persistent dry mouth is one of your body's most consistent and most overlooked early warning signals. Not for dehydration, not because you breathe through your mouth, for 4 specific internal conditions, some of them serious, that are altering your saliva production, your breathing pattern, your blood sugar overnight, and your autonomic nervous system while you sleep. Conditions that are invisible in the daytime. Conditions that have been progressing quietly. Conditions that the morning dry mouth is trying to flag, if you know what it is trying to say. I'm Dr. Eric Berg, and today I'm going to decode that signal. 4 possible causes, each one distinct, each one with a specific intervention, and each one something your morning glass of water is not addressing. Stay with me. Before we get into the 4 causes, drop 2 things in the comments right now. Your age and the city and state where you are watching from. Because this community is being built one person at a time in Birmingham, Alabama, in Houston, Texas, in Memphis, Tennessee, in Jacksonville, Florida, in every bedroom where someone is reaching for their water glass before they are fully awake and has accepted that as the price of getting older. Drop your age and your location right now. And if you wake up with dry mouth every single morning without exception, type the word every in the comments. Because the frequency matters. Occasional dry mouth on a hot night is normal. Every morning, consistently, for months, that is your body repeating a message it needs you to receive. If you want this community to keep growing, hit subscribe right now. The next person searching, why do I wake up with a dry mouth every morning, deserves to find real answers here. Now, something that needs to be said plainly. The oral care industry generates over $1.3 billion annually from dry mouth products alone. Biotene rinses, dry mouth sprays, saliva substitute gels, specially formulated overnight mouth moisturizers. Every one of those products treats the symptom. Not one of them asks why the symptom is there. A 2020 review published in the Journal of the American Dental Association examined dry mouth symptom management in adults over 60 and found that in 71% of cases, the underlying systemic cause was never identified or addressed because the clinical response was limited to symptomatic relief rather than root cause investigation. 71%, 7 out of 10 people managing dry mouth with a rinse and a prayer, while the condition generating the dry mouth continues unaddressed. This channel addresses the condition. Hit like if you think every American senior deserves to know what their morning dry mouth is actually saying. Let us go through the 4 causes. Why saliva is not just moisture and why its absence is a diagnostic signal. Before the 4 causes, the framework. Because understanding what saliva actually does changes the urgency of what its absence means. Saliva is not water in your mouth. It is a biologically active fluid produced by 3 pairs of glands, the parotid, submandibular, and sublingual glands, under the control of the autonomic nervous system, the same nervous system branch that governs heart rate, blood pressure, digestion, and stress response. Saliva contains enzymes that begin carbohydrate digestion, antimicrobial compounds, lysozyme, immunoglobulin A, lactoferrin, that suppress the 700 plus species of bacteria living in your mouth. Bicarbonate that neutralizes the acids produced by those bacteria. Electrolytes, growth factors that maintain the integrity of the oral mucosa. When saliva production drops, particularly overnight, three things happen simultaneously. Bacterial populations in the mouth increase by several orders of magnitude. Acid production from those bacteria rises, and the tissues of the mouth, throat, and upper airway become drier, more susceptible to micro tears, and more vulnerable to infection. This is why people with chronic dry mouth have dramatically higher rates of tooth decay, gum disease, oral fungal infections, and recurrent sore throats. The mouth loses its biological defense system every time the saliva shuts down. But the more important question is not what dry mouth does to your mouth. It is what is causing the salivary glands to shut down in the first place. Because the autonomic nervous system controls those glands, anything that dysregulates the autonomic nervous system during sleep can suppress saliva production. And after 60, 4 specific conditions do exactly that. Consistently, invisibly, and with diagnostic precision that a morning glass of water cannot address. Let us name them, the 4 causes. Cause 1, undiagnosed sleep apnea, the most common and most dangerous cause. If you wake up with dry mouth every morning, and especially if you snore, if you wake feeling unrefreshed despite sleeping 7 or 8 hours, if your partner has mentioned that you stop breathing during sleep, if you experience morning headaches regularly, then sleep apnea must be the first thing investigated. Here's why dry mouth and sleep apnea are so directly linked. In obstructive sleep apnea, the airway collapses partially or completely during sleep. When the airway narrows or closes, the body compensates by shifting from nasal breathing to mouth breathing to maintain oxygen supply. Mouth breathing during sleep bypasses the nasal passages, which are designed to humidify and warm incoming air, and exposes the oral tissues to dry airflow for hours at a time. The saliva that is produced evaporates more rapidly. The mouth tissues dry out. You wake with that thick, sandy, uncomfortable dryness that no amount of biotin resolves, because the problem is not saliva quantity. It is the drying effect of 6 to 8 hours of mouth breathing overnight. But this is the consequence, not the danger. The danger is what the sleep apnea itself is doing to your cardiovascular system during those same hours. A 2021 meta-analysis published in the European Heart Journal followed 900,000 adults across 24 studies and found that untreated obstructive sleep apnea was associated with a 140% increased risk of incident hypertension, a 83% increased risk of stroke, and a 58% increased risk of cardiac arrhythmia, 140% increased hypertension risk. And the morning dry mouth, the thing most people treat with a rinse and dismiss, may be the most consistent daily signal that this is happening during their sleep. A 2022 study published in Sleep Medicine Reviews specifically examined dry mouth as a screening symptom for sleep apnea in adults over 60 and found that morning dry mouth occurring at least 5 days per week had a 68% positive predictive value for obstructive sleep apnea in the senior population. 68%. More than 2 in 3 seniors with persistent morning dry mouth have sleep apnea. What to do? Ask your physician for a home sleep study evaluation. Use these exact words. I wake up with dry mouth almost every morning, and I would like to be screened for obstructive sleep apnea. A home sleep study device is mailed to your address. You wear it for 1 night. Results are reviewed within 48 hours. It is covered under most Medicare Part B plans. If apnea is confirmed, CPAP therapy addresses both the apnea and the mouth breathing, resolving the dry mouth completely in most cases. Cause 2, uncontrolled overnight blood sugar, the diabetic signal most seniors ignore. This cause is specific to seniors with type 2 diabetes or prediabetes. But given that approximately 33% of American adults over 65 have diagnosed diabetes, and an estimated additional 25% have undiagnosed prediabetes, it applies to a significant portion of anyone watching. When blood glucose rises significantly overnight, which happens when the liver releases stored glucose during the early morning hours, a phenomenon called the dawn phenomenon, the kidneys respond by attempting to excrete the excess glucose in the urine. This process, called osmotic diuresis, pulls water from the body to flush glucose out through urine. The result is systemic dehydration that reaches its peak just as you wake up. Your mouth is not dry because you did not drink enough water before bed. Your mouth is dry because your kidneys spent the last 4 hours extracting water from your body to manage your blood sugar. And drinking a glass of water in the morning addresses the dehydration for approximately 30 minutes, while the blood sugar issue that drove it continues unaddressed. A 2019 study published in Diabetes Care found that adults with type 2 diabetes who reported persistent morning dry mouth had significantly higher overnight blood glucose variability and higher average fasting glucose levels compared to diabetic adults without morning dry mouth, confirming that the symptom tracks with glycemic control quality. The dry mouth in this context is not a mouth problem. It is a blood sugar readout. What to do? If you have diabetes or suspect you might, ask your physician to add a continuous glucose monitoring assessment or a more detailed fasting glucose and HbA1c panel at your next blood draw. Ask specifically, could my morning dry mouth be related to overnight blood sugar elevations? If confirmed, the evening meal composition matters enormously. Reducing refined carbohydrate intake at dinner, as discussed in the carbohydrate management video, directly reduces the overnight glucose release that drives the osmotic dehydration, producing your dry mouth. Let me tell you about Gerald, 67 years old, retired electrician, Birmingham, Alabama. Gerald had been waking up with severe dry mouth every morning for 3 years. He went through a bottle of Biotin rinse every 2 weeks. His dentist mentioned dry mouth at every cleaning. His primary care physician attributed it to his blood pressure medication. When we ran a 7-day continuous glucose monitor alongside a home sleep study, Gerald had moderate obstructive sleep apnea and a fasting glucose that was averaging 168 by 6 a.m. Two causes working simultaneously, both contributing to the same morning symptom, neither identified by the Biotin aisle at CVS. Gerald was fitted with a CPAP. His evening meal composition was adjusted. 4 weeks later, he could not remember the last time he had reached for the water glass first thing in the morning. Cause 3. Medication-induced salivary suppression. The silent side effect on millions of medicine cabinets. This is the cause most seniors have been partially told about, but rarely with the specificity to act on it. The statement, "This medication can cause dry mouth," appears in the fine print of over 400 commonly prescribed drugs available in America. But fine print is not a conversation, and "can cause dry mouth" does not convey the mechanism, the cumulative effect of multiple medications, or the clinical options for mitigation. The medications most aggressively suppressing saliva production in older adults: anticholinergic drugs, diphenhydramine, Benadryl, the active ingredient in most PM sleep aids, oxybutynin for bladder control, amitriptyline for nerve pain or sleep. These block acetylcholine, the neurotransmitter that signals salivary glands to produce saliva. When the acetylcholine is blocked, saliva production drops dramatically. Blood pressure medications, particularly ACE inhibitors like lisinopril, and diuretics like furosemide, Lasix, diuretics reduce total body fluid volume, directly reducing the fluid available for saliva production. Antihistamines, including loratadine, Claritin, cetirizine, Zyrtec, and especially first-generation antihistamines like diphenhydramine. These dry mucous membranes throughout the body, the nasal passages, the throat, and the salivary glands simultaneously. Antidepressants, SSRIs, and particularly tricyclic antidepressants reduce salivary flow as a class-wide effect. A 2021 study published in the Journal of the American Geriatric Society found that adults taking 3 or more medications from the above categories simultaneously had salivary flow rates 58% lower than age-matched adults taking none of these medications. Not 10% lower, 58%. For seniors on multiple medications, the dry mouth is not a side effect to manage with a rinse. It is a signal that the combined anticholinergic and fluid-depleting burden of the medication list has exceeded the salivary gland's capacity to compensate. What to do? Bring your complete medication list, every prescription, every over-the-counter product, every supplement to your next physician appointment. Say these exact words. I would like to review my medications specifically for their combined effect on saliva production and hydration. Several medications I am taking are known to suppress salivary gland function, and I would like to discuss whether safer alternatives exist for any of them. For sleep aids containing diphenhydramine specifically, low-dose melatonin, 0.5 to 1 milligram, is a safer alternative that does not suppress acetylcholine and does not cause dry mouth. For bladder control medications, mirabegron, mirbetriq, does not use the anticholinergic pathway and does not cause dry mouth. Alternatives exist. You have to ask for them. Cause 4, Sjogren's syndrome, the autoimmune condition hiding in plain sight. This cause is the most serious and the most commonly missed. Sjogren's syndrome is an autoimmune condition in which the immune system attacks the moisture-producing glands throughout the body, including the salivary glands and the tear glands. The result is chronic dry mouth, chronic dry eyes, and a systemic inflammatory process that over time affects the joints, the kidneys, the nervous system, and in some cases, the lungs. It is the second most common autoimmune rheumatic disease in America, affecting an estimated 4 million Americans. The majority are women. The average time from first symptom to diagnosis is 6 to 10 years because the early symptoms are so commonly attributed to aging, medications, or dehydration. Persistent morning dry mouth combined with persistent dry eyes, gritty, scratchy eyes that you have attributed to screen time or aging eyes is the most common early presentation of Sjogren's syndrome in older adults. A 2020 study published in Arthritis and Rheumatology found that 73% of adults with confirmed Sjogren's syndrome had experienced persistent dry mouth for more than 4 years before diagnosis, during which the systemic autoimmune process was progressing untreated. 4 years. If you have persistent dry mouth and persistent dry eyes, both together consistently, these two symptoms in combination are not a coincidence. They are a pattern, and that pattern warrants a specific blood test. The anti-SSA/RO and anti-SSB/LA antibody panel, which is the primary diagnostic screening for Sjogren's syndrome. What to say? I have persistent morning dry mouth and persistent eye dryness together. I understand that this combination can indicate an autoimmune condition affecting the moisture-producing glands. I would like an anti-SSA/RO and anti-SSB/LA antibody test at my next blood draw. That sentence, that precise request, is what moves the conversation from drink more water to an actual diagnostic workup. 4 causes: sleep apnea, where the morning dry mouth is the daily signal of a cardiovascular emergency happening overnight. Overnight blood sugar spikes, where the dry mouth is a glucose readout that the water glass cannot fix. Medication-induced salivary suppression, where 58% reduction in salivary flow is the undisclosed consequence of a drug combination nobody reviewed together. And Sjogren's syndrome, where 4 years of dry mouth preceded diagnosis while the autoimmune process progressed silently. Not one of these causes is addressed by the Bio-10 aisle at CVS. Not one of these was in the conversation most of you had when you mentioned dry mouth at your last appointment. The oral care industry profits from the symptom continuing. This channel profits from nothing. Hit subscribe right now if you believe American seniors deserve to know what their morning dry mouth is actually saying. Only the people who are completely fine with a $1.3 billion dry mouth product industry treating the symptom while the cause goes unaddressed will scroll past without engaging. Everyone else, subscribe, like, and share. What to do this week, specific and actionable. Self-assessment, 4 questions to answer honestly. 1. Does your bed partner report snoring or observed breathing pauses during sleep? Or do you wake feeling unrefreshed despite adequate sleep hours? If yes, sleep apnea investigation is the priority. 2. Do you have diagnosed diabetes or prediabetes? Does the dry mouth seem worse on mornings after a heavier evening meal? If yes, overnight blood sugar tracking is the priority. 3. Are you taking any medication from the following categories: anticholinergic drugs, diuretics, antihistamines, or antidepressants? If yes, medication review for combined salivary suppression is the priority. 4. Do you also experience persistent eye dryness, gritty, scratchy eyes that artificial tears only temporarily relieve? If yes, Sjogren's antibody testing is the priority. At your next appointment, bring this list and use these words. For sleep apnea, I wake up with dry mouth almost every morning. I would like to be screened for obstructive sleep apnea with a home sleep study. For blood sugar, I would like to assess whether overnight blood glucose variability is contributing to morning dehydration symptoms. For medications, I would like to review my full medication list for combined effects on saliva production and discuss alternatives for any medications with anticholinergic or diuretic properties. For Sjogren's, I have both persistent morning dry mouth and persistent dry eyes. I would like an anti-SSA/RO and anti-SSB/LA antibody screening. One of these sentences, delivered clearly and specifically, changes a dry mouth conversation from drink more water to a diagnostic workup that could identify something that has been progressing for years. Every morning, you reach for the glass and you tell yourself it is nothing. But 4 possible causes, each distinct, each serious, each addressable, have been using that dry mouth as a signal for months, possibly years. And the glass of water you reach for every morning has been addressing the discomfort while the underlying biology continued undisturbed. Sleep apnea with a 140% increased hypertension risk, overnight blood sugar driving osmotic dehydration, a medication list combining 4 saliva-suppressing drugs that nobody ever reviewed together, an autoimmune condition that takes 6 years on average to diagnose, while it quietly attacks your moisture glands. None of these are inevitable aging. All of them are diagnosable. All of them are treatable, or at minimum, manageable, when correctly identified. The water glass helps you get through the morning. The appointment conversation with the specific language from this video is what starts the actual resolution. Hit subscribe because this channel is going to keep decoding the signals your body sends every morning that the 15-minute appointment does not have time to interpret. Hit like because every engagement pushes this to one more senior who has been reaching for the water glass every morning and accepting the discomfort as permanent. And share this video right now. Share it with the person in Birmingham who has been managing dry mouth with rinse for 2 years and whose dentist has never asked about their sleep. With the woman in Jacksonville who has dry mouth and dry eyes together and has been told it is just aging twice now. With the man in Houston who takes 5 medications from this list and whose pharmacist has never reviewed their combined effect on his salivary glands. Tell them the glass of water is not the answer. The answer is knowing which question to ask. They now have the questions. I am Dr. Eric Berg. Your morning symptoms are not random. They are specific, and specific symptoms have specific causes. Find yours. In my next video, I'm going to walk you through 5 other morning symptoms that seniors dismiss as normal aging, including one that appears in your eyes and one that appears in your hands, that each have specific systemic causes worth investigating. If what you heard today concerned or surprised you, that video is going to matter to you. Subscribe now so you do not miss it. I will see you in the next one.